Good afternoon. Thank you so much for joining us today. I have a very special guest on our call today. I have Dr. Gabriel Bonilla, who is going to talk with us today about regenerative medicine. Dr. Bonilla, thank you so much for joining us. Could you tell us a little bit about your clinic and where you are from?
Sure. My primary specialty, Christy, is physical medicine and rehabilitation, also known as a physiatrist. And I have been practicing musculoskeletal medicine and pain management for over 12 years. I treat body conditions that cause pain and dysfunction. And I started to get involved in regenerative medicine about 5 years ago. First, I started doing platelet injections into injured joints and tendons, and then over time I got involved with the use of stem cells and amniotic allograft to repair injured tissue and for aesthetic purposes like facial treatments to rejuvenate the skin and also for hair restoration.
Okay, that's great. So your clinic offers regenerative medicine. Doctor, I know that our listeners today would be very interested in hearing a little bit more about really what is regenerative medicine? What is that?
Sure. Even though this can be a complex subject, if I was to sum it up, Chrissy, I would say that what it comes down to is using your own cell products to coordinate and to stimulate tissue healing, and also about putting your own growth factors to good use. We know that both platelets and amniotic tissue are a rich source of growth factors, and when these are injected into areas where there is damage or inflammation, what they do is they signal the damaged cells to switch into repair mode. So when it comes to our own stem cells, they produce a large number of cell signaling compounds that coordinate and stimulate our tissue healing.
Wow, so it sounds like my body is actually designed to heal itself. How do stem cells work? Can you tell me a little bit more about that?
Yeah. So when we talk about using our own stem cells, these stem cells are collected from our own bodies using different methods. These stem cells then are injected into the damaged area. Stem cells are specialized. When they sense that there is tissue damage, what they do is they coordinate cellular repair activities, and they do that extremely well. What I do is I call them like their quarterbacks, if you may. So not only do they tell other cells to repair themselves, they also tell them to divide and multiply. Actually, they are the smartest and most powerful cells in the human body. These cells are highly concentrated in our bone marrow and within the blood vessels of our fat tissue. These are the two main sources of our own stem cells. And we use medical procedures to harvest these cells from these areas.
Wow. Well, that's all very, very interesting, and it's amazing that our body is, we have all these stem cells in our body. We just need to kind of have the right tools to access them. But what if I have some kind of a blood condition or I'm not comfortable with the harvesting process? I'm not sure how complicated it is, but what if I'm not a candidate for that? Are there other options for me still?
Absolutely. In that case, there are several options available. One of the options is amniotic membrane products. So let me tell you a bit about that. So we know that amniotic membrane and amniotic fluid contain a large number of human growth factors. So nowadays, during childbirth, instead of tossing the placenta or the umbilical cord into the garbage, mothers can choose to donate this tissue, knowing that they can help other people with it. Of course, the companies that process these tissues perform a lot of testing in order to ensure that the tissue is pure and sterile. Placental tissue and umbilical cord blood stem cells also have an amazing quality, and that is that they do not cause rejection when used to treat other people.
That is amazing and so, so interesting. Well, it sounds like we've got the areas covered of where can we access these stem cells, but maybe probably what's going to be even more interesting are what are some of the conditions that are most commonly treated in regenerative medicine?
Absolutely. I would say knee pain, whether it's from a meniscal tear or from arthritis, hip pain due to arthritis, also shoulder pain, whether it's coming from a rotator cuff tear or shoulder arthritis. In fact, any joint that is injured can be injected with regenerative medicine products. For example, hand joints, TMJ, ankles, just to name a few.
Okay, well that sounds like quite a few things, a lot of things that a lot of people, perhaps have. So how quickly after an injury should I seek a regenerative medicine professional if I'm interested in this type of therapy?
I would say the sooner the better, definitely before considering surgery.
Okay, well, I'm wondering if the surgeons like hearing that or if maybe they don't like hearing that.
Well, Chrissy, actually younger surgeons are actually finally catching up with this technology, and
Oh,
I'm very happy to report that.
oh, that is great news. That's great news that everyone's starting to work together to help out the patient's best interest. What other regenerative medicine applications are you performing in your clinic?
Sure. I'm having great success treating hair loss, both in men and women, and I'm very excited about this new method of treating hair loss. Also, when it comes to the face, when your own platelets concentrate is combined with something called microneedling, the results of that combination are amazing. What it does is it will rejuvenate the skin, eliminate small wrinkles, and reduce acne and other types of scars from the face.
Wow, I really like the sounds of that. So can you tell me just a little bit more about microneedling?
Yes. So the device used to do this procedure is called a microneedling pen. This device creates a very large number of microperforations in the skin. And these microperforations, what they do is they activate skin cells into depositing new collagen as they repair these micropunctures. Then, if a concentrate of your own platelets is smeared over the face at the same time as microneedling is done, the rejuvenating and wrinkle-reducing effect is multiplied.
Wow, that sounds great. It sounds like there's a lot of applications from, musculoskeletal to aesthetics to even, as you said, hair restoration. These therapies can cover a wide range of things. How come we don't hear more about this on TV, in advertisements?
Yeah, the reason that you don't see TV commercials on regenerative medicine is due to the fact that there's no large pharmaceutical company behind it to push it. Our own bodies produce these marvelous products, and we're finally learning how to put them to good use. I would also like to tell you that since this is a relatively new field in medicine, the amount of clinical studies out there, it's in the thousands instead of hundreds of thousands, as it is with traditional medicine. But that is quickly changing.
Well, I'm sure as more and more physicians are offering these services, it just makes sense that there's going to be more studies out there that other clinicians have access to. So, in the process of having these procedures done, do patients need to take a lot of time off for this procedure?
Actually, no. You should be able to return to work the same day or the next day.
Oh, fantastic. So there's no real downtime to this. What about insurance?
Well, insurances do not cover these modern therapies. Nevertheless, they sure are a wise investment in your health, Christy. For example, when most patients consider their deductibles for more traditional methods, their out-of-pocket co-pays, the time lost from work, etc., regenerative medicine is a very affordable option. Think about how much the average American spends annually on gym memberships and supplements, personal trainings, and things like that. I would say regenerative medicine, it's personalized to your condition to provide excellent outcomes and long-term healing.
Well, that sure does make sense. It's really as though my doctor is partnering with me in my health care.
Absolutely. We will work together to come up with the best options for you and for each patient.
Oh, wow. Well, thank you so much for your time today. I'm sure there's going to be a lot of patients that are interested in finding out more about your services. How do they find you, and how would they make an appointment?
Absolutely. We're located at East Bell Road in the Loop 101 in Scottsdale, Arizona. And our phone number is 480-510-0960. 9038. And you can certainly visit our website, which is Bonilla regenmedcenter.com.
Okay, I'm just going to repeat that for our listeners. Dr. Bonilla and his staff are located at East Bell Road and Loop 101 in Scottsdale, Arizona. Their phone number is 480-510-9038, and their website is bonillaregenmedcenter.com, and Bonilla is spelled B-O-N-I-L-L-A, regenmedcenter.com. Thank you again so much for this wonderful information, Dr. Bonilla. I really look forward to having you on our podcast down the road in the future.
Thank you, Christy. It's my pleasure.